Hi, you're tuned in to Fit Minutes. I'm Steve Wells, personal trainer at Midland Fitness. I'm with Dr. V, and we're covering a lot of topics about driving since so many of us are having to drive more. And there's a lot of repetitive stress that comes from bad posture with driving. So we're trying to put our heads together to find out how we can coach people to avoid a lot of the common issues that we're dealing with. Dr. V is going to talk to us about the position on your brake and your gas pedal. Some people do use their brake, which, studies have shown that does happen. But when you're going back and forth from brake to gas, this puts pressure on your hip and your knee. Tell us about what's going on here, Doc.
So the big thing we always want to look at is when we're driving, we tend to get lazy and we always tend to kick that ankle out, or what happens is we tend to let that knee and that hip roll out. Well, this chronic thing with the knee and the hip and the ankle all being out for long periods of time eventually causes some ankle pain, will correlate up to that knee pain, maybe even up to some of that hip pain too. So what we want to do is we want to try to keep it as straight as possible so that our leg is in perfect line with the gas pedal itself. When we use the brake, we kind of want to lift up and do the same thing. But I don't like to see people as we're doing this. It's a lot of tension on the inside of the knee, and we shouldn't have that there. So nowadays when we're sitting in traffic, you're at the stoplight, knees rolled in, the ankles rolling in, we're sitting here for long periods of time, we're starting to see a lot of people starting to develop a lot of that knee pain on the inside of the thigh here, okay, or the inside of the knee. So we want to really make sure that we keep it parallel, almost parallel with your dash, okay? Usually there's that fine line with the dash, and that's what we really want to focus on, is keeping it as straight as possible.
That makes total sense. I try to tell people it's really similar to the issues that you have when you cross your legs. If you're sitting too long with a crossed leg, which we know causes hip and knee issues, which we're trying to reduce, so we don't want driving to become almost as bad as an actual sports injury. So thanks, Dr. V. We appreciate it, and we'll be back soon to talk a couple more topics we want to discuss about driving and proper mechanics and posture. So thanks for tuning in.
Thank you.